through on that.
And we actually now want to join Governor Asa Hutchinson live. He is holding a press conference on the latest on COVID.
As well as Dr. Greg Bledsoe, our Surgeon General, is with us, and we have Dr. Jones is coming in also. I first want to express my deep sadness and the heartache of the entire people of Arkansas on the death of West Helena police officer Travis Wallace, who was fatally shot last night in the line of duty. And I am signing a proclamation today that will lower the state flag through the date of his memorial service. And I talked to the police chief today and expressed our heartache over this, and our prayers are with the officer's family as well as with the entire community and with the police department, because when we lose one, and we've lost too many, it's a burden for all of them to care. Now let me go to the purpose of this news conference today, and that is I am announcing the creation of the Governor's COVID-19 Winter Task Force. And this is the result of the fact that the winter months pose particular challenges for us. We have our hospitalization rates that are going up. We have our caseloads that are going up, not just in Arkansas but nationally. And the critical link is our hospitals. And so one of the major focal points of this task force will be to look at our hospital capacity, what more can be done to manage that capacity, coordinate, and what relief the state can provide in terms of support for our hospitals and the staff. And let me emphasize the importance of this and the timeliness of it, because even though our daily report will not come out until later today, I did get a report from Dr. Romero that the last 24 hours we've had an additional 2,312 confirmed and probable COVID-19 cases in Arkansas. This is a record number. We have an additional 21 hospitalizations, and we're at a record number in hospitalizations of 826. This task force is created by an executive order that I've signed today, and created this, and its responsibility will be to investigate, advise, and make recommendations to me. This is a governor's task force that, while the Department of Health will continue to be the lead agency for implementing our fight against the pandemic, it is important to have this task force that will give guidance on this important issue. The reason, as I've said again, is the number of hospitalizations, but also the strain on our staff. And they've been at this for 8 months. Many of the hospital staff, too large a number, has to be quarantined themselves because of exposure, and so that shortens their work time. It puts strain on others. The question is, what additional help can we give that staff? Is there relief from the quarantine rules that make sense in the hospital environment? What can we do to help in that? And that's one of the things this task force will look at. And the staff, of course, is not just because of quarantines, but also because of cost, and the fact that we've got recruiters that are looking at our hospital staff and recruiting them to work elsewhere and giving a bonus for that. So it's a very competitive environment, and we want to see what we can look at further. I want to illustrate this challenge shortly, but I'm asking for the task force to immediately look into and investigate 3 particular areas, actually 4 particular areas. And the first one is, how can we better coordinate the COVID caseload statewide? Last night I was on a call with the Central Arkansas hospital administrators, and I've talked regularly to the different areas of the state, and there's a lot of coordination going within the regions. and there's a lot of coordination going within the regions. We're to the point we need to expand that coordination. I asked this task force to look at this. And this will illustrate it by some of the, if we can show our graph here. The next one. Here's the hospitalizations. You see that just shows that it's a record number. The next one. And this breaks down the percent of hospital resources used by COVID-19 patients. And this is important because whenever the public hears that our hospital staff is strained, you know, our space is limited, they think that, well, our COVID patients take up 100% of our ICU beds or our ventilators, and that's certainly not the case. And you can see here in terms of hospital resources by COVID patients and hospital beds itself, it's less than 10%. In ICU beds, it's 30% down to 28%. Ventilators, you can see, you know, those are different days that's represented there. Wednesday, Thursday, and Friday is the distinction. But you can see the percent is increasing in terms of ICU beds and ventilators, but it's still a small capacity compared to the whole that we have. Now let's go to the next one. And this breaks it down not by public health regions, but by hospital zones. And so here is the Southwest metrics. And you can see the difference here. 60% of the ventilators in South Arkansas, Southwest, is being used by COVID patients. And so there's much greater stress there. 41% of the ICU beds, hospital beds, are over 10%. Next one, the metro region is a little bit, certainly different statistics here on the usage. The next one, Northwest Hospital region, you can see different metrics again as to the percent of their capacity that's being used for COVID patients. Of course, the rest of the beds are being used for elective surgeries, the routine health needs that all of our patients have. And you do not want those to be sacrificed because that's going to put us all in poor health as we go on. And so the hospitals are having to manage both the COVID caseload as well as the regular caseload, and we don't want either one to suffer. We've got to manage between those, and it takes a high level of coordination between all of the hospitals to accomplish that. And the next one is probably the Northeast. You can see different statistics there. The next one, Southeast, and there the ventilators, 85% on Thursday in the Southeast were being occupied by COVID patients, so that's the highest. And so you can see the need for that higher level of coordination. We'll stop there. So I've asked them, how can we better coordinate the COVID caseload statewide? Secondly, how can the state assist in increasing staff resources? And again, there's a burden on the staff. We want to look at ways that we can be helpful to increase their resources, and I want to see what recommendations they come up with. What additional steps make sense for increasing compliance with the mask mandate? Those that are working in the hospital environment obviously want that caseload to be reduced, the hospitalizations to be reduced, and it starts with individual disciplines. And then how can we reduce the number of high cases and reduce the burden on our hospitals? Let me go to, as I mentioned, that I will chair this group, but I need to have an able vice chair, and I've asked Dr. Greg Bledsoe, our Surgeon General, to be the vice chair of this task force. Of course, I will have Dr. Romero on the task force as well, but let me give you a sense of the task force members. Larry Shackelford, President and CEO of the Washington Regional Medical Center. Chris Barber, President and CEO of St. Bernard's Healthcare in the Northeast. Scott Street, Medical Center of South Arkansas in El Dorado. Dr. Cam Patterson, Chancellor of UAMS. Rachel Bunch, Executive Director of the Arkansas Healthcare Association. Bo Ryle, CEO of the Arkansas Hospital Association, Troy Wells, President and CEO of Baptist Health, Ryan Gehrig, President of Mercy Hospital in Fort Smith, and Major General Kendall Penn, Adjutant General, Arkansas National Guard, A.J. Geary, Director of the Arkansas Department of Emergency Management, and yes, both are on there to help us to look into the future for any surge capacity that is needed that's outside of the hospital facility. Dr. Romero, Dr. Geraldine Jones of the Arkansas Department of Health, Dr. Jennifer Dillahay, Dr. Naveen Patil, all of the Department of Health, Dr. Kier Villas, University of Arkansas Medical Sciences, Philip Gilmore, CEO of Ashley County Medical Center, Dr. Stephen Collier, CEO of RCare, Ron Peterson, President and CEO of Baxter County Regional Medical Center, and then I will add additional members to that task force as needed, and as we may have recognized that we don't have everything covered, I will add as needed. The first meeting of this task force will be Monday at 8 a.m. and most of this will be by Zoom call. It will not be a public meeting. It will be a private consultation working session with me and with the Vice Chair, Dr. Bledsoe, and with Dr. Romero. So with that, that covers those items. I do want to add that we are devoting right now for the winter COVID advertising budget $1.6 million to the marketing strategy for the fall and winter. That is $1 million through the Department of Health, and that is an additional $600,000 that will be through Department of Parks, Heritage, and Tourism and AEDC, and we're getting $400,000 of CARES Act funding. And so we understand that's one of the things that has to be done in this environment, is continue and enhance the messaging to broad members of the public as to what they can do. The numbers get their attention, but we want to be clear as to how they can help us. Finally, I did want to mention that I have authorized 30 members of the National Guard to assist the Department of Health in case investigation. As you may recall, we've had a number of our National Guard personnel from time to time through this pandemic assisting in different areas. Whenever we had a decline in our caseload, but also the infrastructure of the Department of Health built up, we sent those National Guard services back to their units. But we are now overloaded again in terms of our contact tracing and case investigation. We need that help because the nurse investigators have a lot on their plate, and we need those additional help from the National Guard. And so I've authorized that, and they'll be working on that deployment in the future. With that, let me turn it open for questions, and I'm sure during the questions that I'll ask Dr. Romero and Dr. Bledsoe to help answer these, and Dr. Jones if need be.